Welcome to another episode of implementation of a laser service in GP practice and skin cancer doctors. Today we have Dr. Satayesh from Adelaide with us. Dr. Satayesh acquired his laser over 5 years ago and successfully implemented a laser service in his clinic. Welcome, Dr. Satayesh.
It's a pleasure to be here.
Let's start by talking about yourself, your clinics first, and your clinical interest.
I'm a fellow of RACGP, obtained it in 2012. Then I got the primary care in dermatology from Australian College of Dermatology and RACGP. Later I went to Skin Cancer College and obtained my dermoscopy. Few more courses and certificates I obtained mainly for skin cancer medicine advanced, and professional skin cancer surgery. Later, I went for the laser as some safety laser courses, and also working in cosmetic injectables as well.
Thank you, Dr. Satayesh. So we are curious to know what motivated you to purchase a laser in the first place.
As a skin cancer doctor, always, every day, you are encountered with people asking many questions to treat certain benign lesions that they don't want it, either cosmetically or because they are irritating. Initially, I was with few patients that I asked to remove, and honestly, I didn't want to remove them because I had to replace them with an unsightly scar. So try to talk them out of procedure for that one. Then I found that really I want something that can give me a little more option to go with minimum time and then less side effects like a bigger scar. That's why I went for laser. And then I try to at least have one of the options. When you see a patient, you can give them all the options. You know, if it's cryotherapy or it's a surgical, cautery, or laser. And laser, it was the main reason I started.
As a skin cancer doctor, you see so many benign skin lesions that it made sense to offer the options to treat them rather than referring. So why did you select the laser blue Derma for your practice?
Sure. Look, what it is, I tried to do a few things. When I was searching, I wanted just to have something to be able to be more portable, to take it from one to the other practice. It was very important for me because I was working across more than one spot. The second thing, I wanted to have minimum of consumables. So it would be easier for me to maintain it, and I know my cost in advance. So I came across to see something that's a little more unique, something that doesn't need anything other than a fume extractor. So and not much big cooling system. That's why cold laser came really, really handy. And I work with that one for many lesions that are very successful. I can just help.
And could you elaborate on the capabilities of this medical laser and the various applications it enables you to treat?
So there are many things. So resurfacing is the main thing I do. Many patients coming asking for example, seborrheic keratosis, seborrheic wart, different warts coming, dermatofibroma, papilloma. These are more for resurfacing. Either they are cosmetically very annoying for patients or they are irritating. Skin tags, for example. Then it comes to dark spots. It works really well for dark spots, and then some, of course, vascular lesions. I do those as well. But majority of things that initially, I decided to go ahead was to replace the need for the surgery. Much more efficient in such a short period of time. Great result.
And when it comes to laser training, did you have any previous experience with laser before incorporating the laser into your practice?
Absolutely, it was zero my experience with laser. It was a very, very first time. And on the training, even I was pretty cautious not to do too much because I had no idea how to do it. But I got with the training was really, really easy and good. We selected very, very choosy about what patient to go safest way. So I started very low and slowly just increased it, and it worked really well, but no experience at all beforehand.
So how quickly did you feel comfortable treating patients?
I think the first day I just had about 3 to 4 patients. The week after I had 10 patients in a day. And I started every single week on a certain day, 10 patients booked for the lab, at least 5, 6 weeks ahead. So I felt comfortable to go.
Listening to you, it sounds like convincing patients for laser treatment is quite straightforward.
Because I was in a position to have many patients asking these, and then all I needed to do was just to tell them that the options. So if a patient comes to me, I give them the options. It's very interesting. I give them the option that you can, do something. You can observe it and do nothing if it's benign. You can surgically remove it. These are pros and cons. You can do the cryotherapy. You may do cauterization or laser. Interestingly, more than 90% of them happily come for laser, although they have to pay more and they have to book later.
It is true that laser treatments are considered gold standards in many applications. They look very high-tech, especially the K-laser with its elegant Italian design. However, laser do have limitations with darker skin types, post-inflammatory hyperpigmentation, scarring, keloids. Do you still offer laser treatment for those patients?
Yeah. I have had some patients that they have very dark tone skin, Fitzpatrick 5, 6 even, with a solar lentigo on their face, and it was very interesting, and their neck. And they were doctors, both of them, and I did it for them. Absolutely amazing the way that it worked. It gave me a confidence because I started on hands, and I found that it's very easy to do. I use a dark spot on K laser, and what I do, I just a little. If they are darker tone skin, I just take my hands a little more distance from the skin. I would not touch it completely. And ask them to put some zinc cream. Some of them, they have a little more hyperpigmentation, is very temporary, and I use a super fade. It's some sort of a cream that I use to take it away and hardly see anything. I do even for resurfacing of lesions, and I haven't seen anything different. It gets some hyperpigmentation, but absolutely no problem. Easily they go away. It takes a little longer for them, for the pigmentation to disappear, but it does.
This is really valuable information. Many doctors are inquiring about laser treatment for darker skin types, so it's reassuring to know that it is possible to achieve some results with careful post-laser care. Regarding typical complications in darker skin types, what about keloids? Do you have a successful protocol for treating them with the blue derma?
Of course, I think there are certain spots in the body that are keloid prone. I tell always the patient that it's a possibility, and if still they want to remove it, I'm talking about the original lesion. I tell them that this is a chance that they can do it. If it happens, first of all, to prevent is just to put a little silicone gel. After that, if it happens, I get them to come back and I inject Kenacort 10, sometimes one, sometimes with a month apart, I do the second one. Still, it's safer than anything else. If you cut keloid, it comes back bigger. So you want to have a minimal invasiveness in treating those things. Injection is a fantastic way. So it is a tool for you. If happens, you can do it. So if a very large pedunculated keloid, for example, especially on ear, or removable laser, start the silicone gel, and they can come back to me while it's very small, one injection, and that's it. Fantastic. It works really well.
It sounds like you have a solid protocol there. Thank you for sharing your experience. Now, could we discuss your business model? You currently own 2 GP clinics with a focus on skin cancer. However, 6 years ago, when you started using the K-laser, you were working as an independent GP in a large group of clinics. Could you describe how you navigated your collaboration with them?
Look, now I have more idea why they accepted when I proposed to them. What I did, I proposed them that I have a new service, and I can use these ones, and then you get a portion or at least a service for you, and I'm happy to stay and treat patients. And they accepted, and it went really well. So at the time, we just chose a time that normally didn't work. For that clinic at the time, they wanted me to work for whatever. The rest, I said that this is a spare time. I use it just for laser. Obviously now, I'm in the other position now. I can see that clearly. I want to give options to all of the doctors and patients. It's very interesting to give the option to patients that this is a service that our practice provides. So it brings more footsteps, and also it's really happy clientele. Of course, it worked really well at the time. I had no idea why. At the time, my proposal was accepted straight away, but it took a little long, and all of patients happy, because they had no idea initially, of course, but even their doctors and staff, because I started treating their own family members and patients for free initially to show how capable this machine is. And they got a trust. The trust came, and they keep referring, and they found really good. Now in our own business, I learned how to implement completely this business model that works really well across, and I have many referrals from many other doctors as well. Because even sometimes patients themselves, they have word of mouth in the last 5 years. So many people, they call and they straight away book as a new patient.
And when you opened your own practice, how did you proceed to gain referrals?
There are a few doctors that I used to work with, they knew me. Then, of course, I developed a website to show everything. I don't want to body shame anyone to say that you need to do this or that. So I created a website, and I can refer patients that they come for something, and they can go explore the website and see, oh, there are options. There are many people who have no idea that they have possibly few bumps and lumps on their face, and they can completely go away without any problem. So they see some before-after pictures, and they just think about it. The same thing applies to doctors as well. So I have internal referral, because I'm mentoring 2 junior doctors in terms of skin cancer. They see many patients. I personally see about more than 20 skin check every day. So it generates a large amount of lesions as well, they ask. And then it's a word of mouth for the patients, and the patients, they go and talk to the doctors. The doctors can, so have a feedback. This worked over time. But we use Google as well, and people go and see. It's a specific web page we have for laser.
All right, so let me summarize the step of laser implementation. First, you build internal referral by treating a few doctors or their family members for free to gain their trust. Then you build a website with pictures and video of the laser treatment for each type of skin lesion, using it as an educational tool for your clientele to avoid body shame. And in return, patients also share the website when talking to their friends. Finally, over time, patients coming to see you for laser treatment as a new patient would also provide feedback to their primary GP, triggering more awareness and external referral from doctors outside your clinic. Now, many clinics train a nurse to use their care laser. I know you mainly operate the laser yourself. Could you walk us through the reason behind it, and if you ever considered training a nurse to use the laser?
I have considered, but haven't done anything yet so far. As I said, I'm mentoring few doctors. So very important to know if this lesion is benign or not. If you are in the position to find out or rule out it's not malignant, it's one thing. So I didn't want to do myself this and then get someone else to do it. It is possible to get them to do for certain things. I just trained one person to do ruby angioma, cherry angioma, those tiny blood vessels, and also pigmentations. But the time that I have to spend to observe them for the time would not be very rewarding for me in any way. That's why I haven't done it yet. However, there is a doctor who is very interested to do it. I'm just teaching that doctor in parallel with C, and then if I'm more confident, because I don't want to have any bad feedback about it, I haven't done anyone yet. But it will be, of course, more efficient and profitable to get assistance from other people.
Now, let's discuss about numbers. How many patients do you see per day and per week?
On average, about between 15 to 20 patients every week. I do laser. Yeah. About 15 easily.
And how much do you charge patients for the different type of treatment?
I charge per 10 minutes. I just have it in mind. I started around 100 plus per patient is a minimum. Depends on the complexity and how many I have to treat. Plus the item number coming from Medicare. It has a gap only, and now is starting from 150. So the minimum is $150 at the moment I charge. When you get more confidence, and also you show your expertise to other people they see, so they are happier to pay for that one as well. And they instead of just cutting, it's much easier. I think everything has gone up since. But on average, between $150 to $350, I charge as a gap. If it's a Medicare. If it's a non-Medicare and it's just purely cosmetic, it adds another between $50 to $150 on top of it.
Thank you for mentioning Medicare. It was my next question. There are Medicare conditions and non-Medicare conditions. You charge a gap between $150 to $350. So if I calculate for a pure cosmetic application, you charge between $200 and $500 plus GST. So which clinical applications are associated with Medicare numbers?
It used to be 2 item numbers for laser. One was for resurfacing, but they scraped it off and then replaced it by attendance. So it's attendance-based. It means that if a patient has an eligible lesion that they are medically indicated to remove, because it's irritating for any problem, not cancer, of course, they would attendance-based. If it's 10 minutes or 20 minutes, there are different item numbers for that one. Logging a consultation, and you can add a gap on top of it. Used to be an item number. Or it could be vascular. Any hemangioma that's visible from 3 meters on face and neck, 6 times a year, you're eligible, you can bill the Medicare. I think it's about $140 each time there is a rebate, plus $150, of course, as a gap.
Let's discuss the financial aspect of your laser service, if you don't mind. Do you advertise any pricing on your website or in your clinic?
I put it between $150 to $350 gap, usually. But I definitely give them a fixed price, 100% accurate on the time of consultation. I tell them, this is going to be yours, regardless of how much time I just spent with you. Definitely, I think everyone wants to know how much they do. So I can tell them, look, this is this amount of time you need, and that's a whole price, as a once off. If it's not vascular or pigmentation. If it's the case, I can tell them, look, you need another 20 minutes later on or 10 minutes, and it will be that much again. So I can tell them in advance. Usually I guarantee my work. If I tell them that this is 10 minutes, you have to pay this amount, it's guaranteed. Even if it relapses, I do it for free, the rest. But usually in my mind, I do it in a way I consider the time I have to spend and the number of lesions. So this is a rough thing that you come, and I think it's a simple thing. People need to know how much they have to cough up when they come for any treatment in advance. So,
based on the price of the laser, what was the time frame within which you were able to recoup your investment at the time?
Yeah, of course, it's very important. I think because the price is not just you pay something and then you get the patient and they pay off. There are multiple things. Depreciation is one thing. So I consider the depreciation of the machine when I obtained it. Then because it was through the finance, I even could obviously claim the interest. For me, it took about 2.5 years to return the whole lot, so it paid off in less than 2.5 years. However, I think when you try to establish a business for yourself, the number of patients coming to you for different reasons, they know you for laser, they come for other things, for cosmetics or other things as well. This is not included in that profit. So in my opinion, that you should be able to be convenient for the patients. It's a one-stop shop, you can say. You can tell them that, look, I can remove it for you, I can laser it off, I can cryotherapy, just treat it with cryotherapy or cauterize it. When you have all of the options, this gives a different level of service to the patients. I see it that way. But in particular, the cost came back less than 2.5 years back.
All right, so you paid off the laser loan in less than 2.5 years, but the clientele for laser treatment also wanted other treatment done, which boost your profits as well. What about the recent years? What is the profitability of your car laser service nowadays?
I'm not working a lot on the laser at the moment. To say that I'm just a laser business model I have is a combination of mainly skin cancer and cosmetic and laser that are like a side business. But I can tell you that on an average, $100,000 plus per year from laser.
You are using the laser 1 day a week with an average of 10 to 15 patients per day. That's a great return on investment for a side business. Now, if you were to start all over again, would you do anything differently? Would you still choose to purchase the Laser Blue Derma?
Look, of course, I would go ahead and purchase something that it just differentiates you from your colleagues. You are on a different level that they can't offer the same. However, I started as an independent doctor in a different business. Now I have my own businesses. Those 2 locations, possibly I would have done one for each and go out from the clinic. This is I purchased from my own personal account rather than to be a business. It would be easier to go through a business. So definitely I would do it, yeah.
Thank you, Dr. Satayesh, for sharing your journey with us. We wish you continued success with both of your clinics and your car laser.
Thank you very much. It's a pleasure.